This healthy living tip is brought to you by the Christ Hospital Health Network.
The time to have surgery is when you feel your hip or knee interferes with your life significantly, assuming that you have a diagnosis of arthritis. And most people, when I tell them that, they want me to tell them when it's time to have surgery. But then when they finally come to have surgery, they come in and they say, now I know what you meant, and I want to have a new hip or a new knee. One of our huge strategic initiatives at the hospital is orthopedic and spine care. And we also feel to invest in the community, we've elected to build a facility in the city of Cincinnati, in Mount Auburn, so that it's accessible for our entire region, not just Cincinnati, but also Indiana, Northern Kentucky, and farther out maybe into West Virginia. What we've tried to incorporate into that is a one-stop shop where we have all the services that you would need. It's in a state-of-the-art facility, which is very comfortable for patients and for their families. And also we've built into the facility the ability to expand and add new technologies as they become available. We have, on a staffing point of view, probably the best staff for orthopedic services of any hospital in the city. We're attracting more orthopedic surgeons to come and work at our facility, primarily because of, number one, the staff, and number two, the facility. So we think our potential for continued growth and high-level services that we can provide will continue to grow into the years. Our goal is to try to prevent you from having pain. And quite a few years ago when we began our pain control program, the goal was to use a preemptive pain management solution such that as you come out of your anesthesia for surgery, you don't have that experience of a lot of pain. And what it appears is by not having that initial episode of a lot of pain, overall you're far more comfortable and you recover faster because you're not afraid to move around and get up. Better pain control has clearly been related to a shorter hospital length of stay. And that's a huge benefit. I mean, clearly most people want to get out of the hospital, and the less exposure you have to a hospital, the far better just for your general health. Right now, we are becoming the highest volume hospital for joint replacement surgery. And one thing that definitely correlates to success and low complication rate is high volume providers. So you want to be attracted to a surgeon who is a high volume surgeon, and we have two of the highest volume surgeons at our hospital now. But then also that means our staff is used to dealing with a high volume of joint replacement patients. And once you get into high volume areas, it's been clearly shown that complication rates decrease and overall outcomes improve. My vision for the hospital is that we become the destination hospital for people who opt to have a hip or knee replacement. They may have seen another physician in the community or even outside of our region, but through our reputation, they decide that if it's time to have surgery, I want to go to Christ Hospital to have my surgery.
For more information about total joint replacement or other orthopedic surgeries at the Christ Hospital, call 585-BONE.